We have a good friend of ours joining us in studio right now, Dr. Molly James from reBalance Clinic and MedSpa, as we're talking about a topic that we've been talking about for a while this month, Jackie.
Well, it's still October, so everybody knows it is Breast Cancer Awareness Month, so we want to keep that conversation going. And you being a doctor and someone who's constantly making sure people are taking care of themselves, there's some things we want to think about as we're keeping this at the front of our minds.
There is. So one of my passion projects has always been breast cancer prevention or risk reduction.
Okay.
So I started out as a as a breast surgeon or a surgeon taking care of women with breast cancer. So hormones have been on my mind for a really long time.
Wow.
So I kind of looked at that from a different perspective. And also I'm a patient who's at high risk myself. So early on in my career, I wanted to know what things can I do to lower my risk on a daily basis. So that's been a lot of my focus. And one of my research projects when I was a resident at Mercy Medical Center was talking to women about what are you doing to reduce your risk of breast cancer.
Right.
And the sad thing they would say, because this isn't something we talk about, is I'm getting my mammograms.
Right, I'm doing the self-exam, I'm getting my mammograms, and that's pretty much
Which is
the
great.
extent.
Those are really important things to be doing, but
Right.
that's not prevention, that's detection. So there are things people can be doing.
There are things you can do.
Yeah, there are. So, you know, everybody thinks, or a lot of people think that genetics is really important, and if
Right.
you have a family history,
Right.
that you either are destined to get it or you'll never get it. And the thing is, that's only 20% of people. So about
Really?
about 1 to 5% are genetic.
Okay.
So those are things we can test the DNA for, and those are very different treatment protocols. Those patients know who they are based on their family history. So, and about 10 to 15% are familial, which means your mom, your sister, somebody had it. That's not genetic, but think about it. We eat the same foods, we live in the same places, we have the same habits. So that's probably some of the attributes of that.
Okay.
80% usually happens in women spontaneously, which means there's no family history. That's really consistent with what we know. About 80% of it is lifestyle. And so that's where people really can make a mark in reducing their risk.
So you're saying there's things I can be doing on a regular basis that could help with prevention?
There are, and 3 or 4 of the most important ones. One is inflammation in the body. So if there's anything going on causing inflammation, and we can detect that with a blood test called a CRP or C-reactive protein, if that's elevated in patients, we need to be looking for the source of that inflammation and treating that at the root cause. So inflammation is a huge one. Diet is really important. When you look at it, you know, again, it goes back to that eating fruits and vegetables.
Right.
The things that make fruits and vegetables colored are the things that feed our detoxification pathways. And so that's really where we want to focus. Also, exercise. So this
I knew you were going to say exercise.
I know, right? I know. So that's not just woo-woo and we want you to feel good and hey, that's good for you. It actually lowers the estrogen levels when you go out and do a hard workout. So doing that 30 to 40 minutes a few times a week for women lowers the exposure to estrogen. So.
And that helps, in many cases, prevent something like breast cancer from happening.
There's some data out there that in women who've had breast cancer and they are active, they maintain a healthy weight, that their risk of recurrence is a lot lower by doing those things, yes.
And it seems like all 3 of those tie in together too. You mentioned inflammation, and then you followed it up with diet, and the diet might be the cause of your inflammation.
It might be, and that also ties into blood sugar. So if somebody's blood sugar is elevated, diabetics have higher risk for this as well. So we want to be looking at blood sugars and taking care of that at the root source.
And those are 3 things we can do on a regular basis without, you know, investing anything too expensive or anything like that. We can keep an eye on what we're eating every day if we're staying active and just kind of keeping a check on our body if there is any inflammation or something else that's throwing up a warning sign. But let's say we want to take it a step further. Are there various supplements or things that we can do that can also put us on the right path? Sure.
And actually before I got into the hormones at reBalance and got into functional medicine, I was taking those. So it kind of fed nicely into the next part of what we're doing. So we use a supplement called DIM, diindolylmethane. That comes from cruciferous vegetables, your broccoli, cauliflower, and your Brussels sprouts. So it comes from that, and what we know is testosterone and estrogen metabolize out the body in 3 pathways. One pathway reduces your risk of breast cancer, and the other 2 either increase or we don't know the effect. So what DIM does is make sure any estrogen in the body gets detoxified through the safest pathway. So that's a really important one. Again, you can get it from eating the fruits and vegetables, but you can also take it in a supplement.
But realistically, how many people eat enough fruits and vegetables to get enough of the supplement, or the element, I should say, to do any good?
Unless you're really on top of it and that's your focus, not very many, unfortunately.
Okay, and how often are we taking this supplement then?
Every day.
Okay.
It's a daily. There's a couple of other ones. There's something called IC3 that kind of ties into DIM, same mechanism of action. And then when I did my own genetic studies to see how I detoxify, one of the things, I take something called calcium D-glucarate. So anytime we want to get rid of something from the body, we have to plug a chemical entity on it so that it gets eliminated. So anytime we want to feed those pathways.
So it jumps on board of that and then leaves? Okay.
Yeah.
Okay.
So anytime we want to feed those, get rid of something, we want to feed those pathways so those chemical reactions happen faster in the body to get rid of it. So
unbelievable.
And that's the basis of what your practice is all about, is trying to utilize these methods to just help make a healthier you.
Absolutely.
Do we have some of those tests available at reBalance that we can take to see, you know, how things are functioning and things like that? Obviously, you want to have a good conversation with your regular physician, but you're there to say we can get you rebalanced, basically, so you are doing things positive in your life.
We look at things other people probably don't as often. It's pretty standard that patients who are high risk have things like BRCA and those kind of high-risk genetic tests through their oncologist or their breast surgeon or the genetic counselors. And we don't do any of that at our office. We're looking at the other things that feed into those detoxifications, more the indirect route.
Right.
Okay, so what would be the first step? If somebody's watching right now and they said, you know what, I need to do this, I need to be preventative, which is a lot easier to do than reactive, what would be their first step?
The first thing I would recommend is talk to your doctor about your actual risk. So getting a handle on that. Again, we kind of fall into two camps, that I'll never get it or I definitely will get it no matter what I do. And those just not quite that way. There's always things you can do. Again, 80%, if you get your lifestyle right, we have a huge opportunity to reduce the incidence. So,
which would be amazing. So come in and have a conversation of things you can do on a regular basis before you get to the point where you're getting a test done and you hear those unfortunate news that you might have breast cancer.
They can also follow us on Facebook. I try to present a lot of information on there, do a lot of teaching through that, provide resources for patients. Certainly if they feel like they're at high risk and want to be proactive about it, we're happy to see them in our office, offer those, you know, discuss what the testing options are. I always recommend too, stress reduction. People, I mean, I think everybody is stressed out these days. We're all on the go, go, go mode, and that feeds disease. So anybody who is at a little bit higher risk, that's a huge opportunity to stop, you know, do some meditation a couple times a day, take 5 minutes just to stop your mind, clear your mind, be thankful for things. And
your body might be wore out trying to defend everything that it's attacking it. So you just need to just mellow out. And to take care of that. And you can give some suggestions of how to do that as well?
Yeah, I can. I think most of the people, I'm kind of new to meditation myself, and so I think the people who are really go-getters, we worry that we're not doing it correctly. And there's no wrong way to do it. Even the attempt to try to clear your mind for 3 to 5 minutes is effective. So there's some music that you can listen to. There's a certain frequency. I actually have my patients go on YouTube and they can look under tonal music for like relaxation. Tonal, T-O-N-A-L, tonal music, and you can listen to that as you do your meditation, even if you're just sitting in the car in traffic for a minute or so. Just kind of take some deep breaths and slow it down. That, there you go. Something as simple as that actually makes a huge impact.
Can make a difference as we're trying to be aware during Breast Cancer Awareness Month. Dr. Molly, thank you so much for joining us this morning. If people want to learn more and keep this conversation going, how can they get in touch with you besides checking you out on Facebook?
Yeah, check us out on Facebook. We have a website, and then they can call our office at 515-257-8150, and we're just down the street on Westtown. So
absolutely.
into our office.
Well, good to see you again.
Yeah, thank you so much for having me.
Thank you.